Hi, my name is Shan Boodram and I'm a sexologist and intimacy expert who has had the great privilege of talking about sex in some very interesting places. But to be honest, you might just be my most important audience to date. Because of you and your service, my life and the lives of all Americans have been happier and healthier. So it's only right that we ensure we return the favor, specifically by teaching you about your sexual health. Now, as a member of the U.S. military service, are you aware of all of the incredible tools and services that are available to you? And if you're not, we're gonna change that today. So I put out a call to military and ex-military members to share a story about their sexual health. These stories are raw, they're real, sometimes they're a little ridiculous, but above all else, they are honest and they are designed to hopefully teach you something that you didn't already know. Okay, are you guys ready? Let's take a look.
My best friend and I were both stationed in Hawaii when we found out he was HIV positive. He was only 20 years old at the time. I felt so guilty because when we went out to the club on the weekends, I was way more promiscuous than he was. And we usually have way too many drinks or find some girl to dance with. And I remember one night I saw this girl in a really tight red cocktail dress looking so fine. And I remember buying her a drink and then another drink. And by the end of the night, she was at my house, but I didn't really even remember much until the next day. And I knew I didn't have any condoms at home. And I didn't even know this girl, so I got kind of scared and I suggested to my best friend that we go to the clinic together, just to make sure we're safe. So we decided to go to the clinic together the next day. It was super simple, almost just like another thing on a to-do list. No one really thought much about it, but I just wanted to be safe. So I got tested and so did my best friend. And I remember we're sitting there waiting for the results and I was a little more nervous than he was for sure. And my test results came back negative. And his came back positive. He was just in shock, and I was too. I was way more promiscuous than he was. But then after the initial shock wore off, we did research and found out that the military actually fully covers the cost of HIV medication. My best friend's diagnosis was a blessing in disguise, because I started taking PrEP as soon as I found out, and I also found out the military fully covers PrEP as well.
And best of all, it's preventable. We have incredible tools like PrEP that help to prevent HIV. If you are HIV negative, using PrEP can reduce your risk of getting HIV by over 90%. If you are HIV positive, using effective antiretroviral therapy can reduce your risk of passing on HIV. And people, let's not forget about condoms.
I was 20. Young, sometimes irresponsible. I was just a kid. And I was stationed over in Germany. And that the days were pretty stressful. So at night we kind of went wild. We went out a lot. And one night in particular, I met this girl and I could never forget her, no matter how hard I tried. She was beautiful. She had long blonde hair and this tight blue dress, and she was perfect. And we were at a nightclub, we were dancing and just danced together the whole time. Before I knew it, it was 2 a.m. We had some drinks and we were really feeling each other. So I decided to take her back to my place. And before I knew it, clothes just started coming off. They were coming off before we even got to the room, for real, but yeah. And everything that the military told me about safe sex just kind of went out the window. Growing up, it was hammered into my head that using condoms prevent STDs and STIs. But I guess you gotta use them in order for them to work. Fast forward a few weeks, and I started feeling uncomfortable down there, like itching, and so I freaked myself out. I went to Googled a bunch of symptoms and it told me that I had all the symptoms of an STD. So I decided that at that point that the military got me, that I'd go to a doctor, get checked out. Sure enough, the doctor told me I had caught gonorrhea, and that usually a lot of people don't even show symptoms. So it's a good chance the girl didn't even know she had it. I guess I was just one of the lucky ones.
As you can see, you can't rely on symptoms to know if you have a sexually transmitted infection. That is why you have to get tested, and you should and can go to your military provider anytime you think you may have been exposed.
He treated me and sent me on my way. He also told me that if I hadn't been seen, the health risks of gonorrhea were pretty serious. I thought I learned my lesson. You fast forward a week or two, maybe about 2 weeks later, and I'm feeling real good. Go out again, same thing happens. I got gonorrhea a second time. The military does a good job of telling you to practice safe sex. They give you all the tools, but they really only work if you use them.
Women are screened annually for chlamydia and gonorrhea. Men and women are screened every 2 years for HIV.
So as you know, as a single woman in the military, sexual urges are pretty high and there's a lot of tension. But getting pregnant is not on my list of priorities. So I'm gonna tell you a story, but it's not my story. A sergeant I used to work with, she got knocked up pretty early on after enlisting. So one day my friend came to me and she told me that she had recently broken up with her boyfriend, but like the rest of us, she still had some needs. So she showed me who he was, and you know, I approved, even though he wasn't much my taste, he was very much hers. So yeah, they ended up started dating, and she was on the pill, but you know how things are. We would go and work out really early in the day or take shifts, and a lot of the time she forgot to take it. The thing about the pill is if you're not taking it regularly, it's not gonna work. And because we were so busy on service, either taking turns at post or working out, we were very forgetful, or she was at least.
There are so many options for contraception, which is why it is your right to find the one that is best suited for you. If taking a pill every day at the exact same time is a challenge for your lifestyle, I want you to consider a LARC, a long-acting reversible contraception. All right, so just know that you got options.
Me personally, I went and got the IUD as soon as I enlisted. It's free of charge and lasts 3 to 10 years, and I can always take it out if I want to have a kid. Or you could get one of those implants in your arm. So many options that seem like a no-brainer to me, especially if you're forgetful or super busy running around like we were in the military. So my friend ended up pregnant in the military, and while she couldn't get an abortion through the military, she did end up finding other options. She had to learn the lesson the hard way, but you guys don't have to. Please, please, please look into long-term contraception, especially when the option is there for you and free for you.
A few years ago, I was dating a guy in the same unit as me, and things got pretty serious. Like, we were talking about marriage. So one night, we were pretty hot and heavy, and I noticed something weird down there, but it wasn't directly on his junk, so I decided just to go for it anyway. And then, of course, I thought about it later and brought it up in bed. And when I spoke to him, he said it was new and he was nervous, and he already spoke to the doctor about it and made an appointment. And I was taken back. I was pretty impressed. We were having an open and honest conversation about a potential STD, and neither of us were freaking out about it. And then, of course, a few days later, he hits me with the, "We need to talk." And of course, I'm obviously thinking he must be cheating on me, because that's the worst, right? And then he mentions that he got the skin tag removed, and the doctor called to say he had HPV. And he didn't know much about HPV, so he was scared, he was freaking out, he thought he could have given it to me, he was worried that he could get cancer, but also he had no idea who he could have even gotten it from. Well, luckily, when I joined the military, I immediately got vaccinated because they offered free vaccinations. He had no idea that men could get HPV or they could even get vaccinated. It's so easy to prevent it. Honestly, just get your shots.
She's right, just go get your shots. Almost everybody's exposed to HPV at some point, and the HPV vaccine helps protect men and women from both genital warts and HPV-related cancers.
Then, of course, later that night, we're hanging out, we're watching the Ali Wong special, and she talks about giving her fiance HPV right after he proposed to her, which had me dying laughing. And of course, my boyfriend was laughing now because I was laughing and he thought I was being ridiculous. But hey, HPV is so common, it's televised. And also, a laugh's a laugh. I'll take it.
All right, so to recap, the military provides resources for testing and treatment of HIV and sexually transmitted infections like chlamydia. They also offer PrEP to help prevent HIV. If you need birth control, ask about options, including long-acting reversible contraception. I have one, and personally, it's one of the best decisions I've ever made. When it comes to HPV and cervical cancer, get the HPV vaccine and get screened regularly. Okay, that brings us to the end of this video. I want to give a big shout out to everyone who bravely shared their stories. Hopefully, they help to enlighten you and lighten your mental load. In short, when it comes to your sexual health, know that you are not in this alone. Make sure you find out what services are available to you and check out our resources at ashasexualhealth.org/military. Take care.
I hear love in the air. I smell love.